Adverse childhood experiences, ACEs, are potentially traumatic events that occur in childhood. ACEs are preventable. There are a number of factors that may increase or decrease the risk of perpetrating and/or experiencing violence. For example, experiencing violence, abuse, or neglect. Witnessing violence in the home or community. Having a family member attempt or die by suicide. Aspects of the child's environment that can undermine their sense of safety, stability, and bonding, such as growing up in a household with substance use problems, mental health problems, instability due to parental separation or household members being in jail or prison. ACEs can have lasting, negative effects on health, well-being, as well as life opportunities such as education and job potential. These experiences can increase the risks of injury, sexually transmitted infections, maternal and child health problems, including teen pregnancy, pregnancy complications, and fetal death, involvement in sex trafficking, and a wide range of chronic diseases and leading causes of death such as cancer, diabetes, heart disease, and suicide.
In this real-world example, a young woman named Naomi must deal with the consequences of her ACEs. Let's see if you can now spot the ACEs in little Naomi's childhood. In the real world, we would not be sitting in Naomi's living room to see that her mom has a substance use disorder or that dad is away for work so much that little Naomi is developing emotional complications due to his absence, and no amount of gifts could ever replace what she needs from her parents no matter how much they might love her. Naomi's parents have big dreams for her, and both work very hard to help her achieve them. Dad works so much that he is hardly ever home. Mom's substance use disorder grows over time to the point that Naomi hardly ever sees her parents anymore unless she is accepting a new trophy or award at school. This leaves Naomi to make many decisions on her own at a very vulnerable age. On the surface, most of Naomi's friends and teachers think she has it all and will be very successful in life. She gets good grades, has lots of friends, and is even up for a sports scholarship to a big-time university. But what not everyone can see is that Naomi has gathered several ACEs, and this has affected decision-making when it comes to making good choices outside of her very structured life at school and home. As Naomi's ACEs pile up, so do her bad decisions. It is estimated that if a child gathers 4 or more ACEs before age 18 that they are at increased risk for all the issues we stated in the earlier education piece. So Naomi is well on her way toward disaster with more than 5 ACEs and counting by high school.
Luckily for Naomi, this never had to happen. Someone close to the family helped her parents see that their decisions were potentially hurting Naomi. So mom got help for her substance use disorder while Naomi was still young, and dad even started spending a little more time at home. Due to all the healthy family time spent together, Naomi even got a really special gift from the new family time situation. His name is Nathan, a little brother who, while annoying, did not create extra ACEs for Naomi, and she even loved sharing her toys. Sometimes, Naomi, having very few ACEs, was able to grow up and achieve most of her and her parents' goals for her. This didn't mean that life was always easy, but the alternatives would not have been favorable. If you have heard the saying, the apple doesn't fall far from the tree, then you have a real understanding of the consequences of ACEs on children. Like mother like daughter could have been Naomi's branded destiny if not for that one person who spoke up for her well-being. Naomi was able to grow into a successful businesswoman, a happy wife of a loving stable husband, a wonderful mother of 2 beautiful twin daughters who have few if not 0 ACEs, breaking the chain of events that could have led to disaster. If you or someone you know need help or resources, please reach out to NAMI Louisville. We care and we are here to advocate, support, and educate those who seek to live a more mentally healthy life.